Emollient combination No.119 topical cream is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. Emollients are substances that soften and moisturize the skin and decrease itching and flaking. Some products are used mostly to protect the skin against irritation from wetness. This cream works by forming an oily layer on the top of the skin that traps water in the skin. It also contains ingredients that soften the top layer of skin cells, helping the dead skin cells to fall off, keeping the skin hydrated and leaving it feeling smoother and softer. Be sure to use this product as directed and follow all the instructions on the package. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For example, if you are treating dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you are using this cream for diaper rash, make sure to clean the diaper area well before applying the product. And if you are using it for radiation skin burns, be sure to check with radiation personnel before using it. It's important to only apply the cream to the skin and avoid sensitive areas such as your eyes, mouth, nose, and vaginal/groin area unless directed otherwise by the label or your doctor. Be sure to consult your doctor or pharmacist for more details. For best results, use this medication regularly and apply it to damp skin, such as right after bathing or showering. If your skin is very dry, your doctor may instruct you to soak the area before using the product. And remember, long, hot, or frequent bathing/washing can make dry skin worse. If your condition doesn't improve or gets worse, or if you think you may have a serious medical issue, seek medical help immediately. When using Emollient combination No.119 topical cream, it is important to be aware of potential side effects. While most people can use this cream without experiencing any adverse effects, some may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to consult your doctor or pharmacist. If your doctor has prescribed this medication for you, it means that they have determined that the benefits outweigh the potential risks. It is important to note that many people who use this cream do not experience any serious side effects. However, it is important to notify your doctor immediately if you notice any unusual changes in your skin, such as it becoming white, soft, or soggy from excessive wetness, or if you notice any signs of a skin infection. While it is rare, a very serious allergic reaction to this cream can occur. If you notice any symptoms of a serious allergic reaction, such as a rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you notice any other effects that are not listed here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using this product, make sure to tell your doctor or pharmacist if you have any allergies, as this product may contain ingredients that could cause allergic reactions. If you have skin cuts, infections, or sores, it's important to consult with your doctor or pharmacist before using this product. Some of the ingredients in this product, such as preservatives and fragrance, may make you more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when spending time outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor right away. If you have acne-prone skin, look for the word non-comedogenic on the label to ensure that the product will not worsen acne. Additionally, some products may stain or discolor clothing, so it's important to ask your doctor or pharmacist for more details. Before undergoing any surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to let your doctor know before using this product. Additionally, if you are applying this product to the breast area, consult your doctor before breastfeeding, as it is unknown if this product passes into breast milk. It's important to understand that using Emollient combination number 119 topical cream may interact with other medications and potentially increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure your safety and the effectiveness of your treatment. If this topical cream is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. To prevent dry skin, it's important to use lukewarm water when bathing, and try to bathe less often, ideally every 1 to 2 days. Keeping baths or showers short and using a humidifier when the air is dry can also help. There are various types of emollient products, some of which may contain fragrance or other ingredients that could cause sensitivity in some individuals. Emollients come in different forms such as oils, creams, lotions, or sprays. It's best to consult with your doctor or pharmacist to find the product that's most suitable for your needs. If you forget to use this cream as scheduled, use it as soon as you remember. Don't use extra cream to make up for the missed dose. Make sure to check the storage instructions on the packaging, and if you have any doubts, consult your pharmacist. Keep all medications out of reach of children and pets. Avoid storing the foam canister in high heat or near an open flame, as it is pressurized. Do not puncture or burn the canister. Do not dispose of medications in the toilet or drain unless directed. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.